Hi, my name is Nancy Borbon. I'm a student nurse at the University of South Alabama College of Nursing, and today I will be performing my medication administration checkoff. So I'm going to go ahead and show my badge ID for verification. All right. And next, I'm going to go ahead and give a ring scan. So I'm in my full College of Nursing apparel. All right, so I'm in an interruption-free zone area. All right. I think that's good. All right. So the first thing I will be doing is I will be comparing my patient's MAR and my patient's order form to see if it's 100% accurate and if I have evidence of legal prescription, if I'm able to administer his medication. So I have Jaguar J. Jones's order form and Jaguar J. Jones MAR. His MR number is 4176352. MR number is 4176352. He does have an allergy to penicillin, and I'm in section 105 with Dr. Johnson, so I will be administering Novolin R regular insulin. So I'm gonna go ahead and see if that medication has been ordered for my patient, and it has. So the drug is Novolin R regular insulin U100 insulin, Novolin R regular insulin U100 insulin. I would need 10 units, and I would give this subcutaneously, 30 minutes before meals. And insulin is used to regulate the patient's blood glucose levels. So this is why I would administer to a diabetic patient before their meals. All right. Now I have verified that both the MAR and the order form is 100% accurate. It matches up, and I have the evidence of legal prescription, so I am able to administer Novolin R to Mr. Jones. Right, I'm gonna go ahead and set the order form to the side. I'm gonna take my MAR, I'm gonna walk over to the storage unit. Right, so I'm in the storage unit. Alrighty, so this is where I'll complete my first check of accuracy. I'm gonna go ahead and wash my hands. Alright, so I'm still in Jaguar J. Jones MAR. His MR number is 4176352. He does have an allergy to penicillin. The drug I would need is Novolin R regular insulin U100 insulin. So I'm gonna go ahead and look at the medication drawer to see if I have that, and I do. So I have Novolin R regular insulin U100 insulin, and it expires December 1st of 2025. So I am good to use it. All right. Next, I would need 10 units of this. So since it is an insulin injection, I will use an insulin syringe here. All right, and I'm gonna take an alcohol prep pad. All right, so I'm gonna go ahead and perform hand hygiene. Take this alcohol pad. Go ahead, clean the top of it. Leave that on there just so I know that I have cleaned it. And 10 units, so take that. Alrighty, gonna take this off here, uncap this, and then I'm gonna go straight down and pull back 10 units. Right. I'm gonna pop this safety cap on. Making sure I have no air bubbles. And then I have 10 units of insulin in my syringe here. Does that focus? Okay. Right. So I will be giving this subcutaneously 30 minutes before his meal. So I'm gonna go ahead and check. Yep, it's almost meal time. He still hasn't received his insulin shot yet. And insulin is used to regulate the patient's blood glucose level. Right. So now that completed my first check of accuracy. I'm gonna go ahead and create a label for my syringe. And on the label, I'll be writing the patient's name. So this medication is for Jaguar J. Jones. And it is Novolin R insulin. So I'm gonna go ahead and see, yep, I do have Novolin R insulin in this syringe. And it should be 10 units, and I do have 10 units in this syringe. And if I also had to do any calculations, I would get another nurse to verify my calculations as well before administering this medication. So I'm going to go ahead and take this label, I'm going to stick it on to the syringe here. Alright, so this is how it should look like. The label on the syringe. Right. Next, I'm going to go ahead and complete my second check of accuracy before heading over to Mr. Jones's bedside. So I have Jaguar J. Jones. His MR number is 4176352. He does have an allergy to penicillin. The drug should be Novolin R regular insulin, U100 insulin. I'm going to go ahead and check. Yep, Novolin R regular insulin, U100 insulin is not expired yet since it expires in December of 2025. I will need to administer this 10 units, and I do have Jaguar J. Jones' syringe here, and there is Novolin R insulin in here, and it says there's 10 units. So I'm going to go ahead and see. Yep, I have 10 units in this syringe. And I'll be giving this subcutaneously, so I can get this at his dorsolateral aspect, or I can give this on his abdomen or his vastus lateralis. It does say on his MAR that I can give it on his abdomen or vastus lateralis. Right, and I will be giving this 30 minutes before his meals since he is a diabetic patient, so I would need to administer this before his meals. So I'm going to go ahead and check here. Yep, it's almost meal time. He still hasn't received his insulin shot. So that completes my second check of accuracy. So we are able to leave the storage unit and head over to Mr. Jones's room. So I'm gonna go ahead and take my MAR. I'm gonna take my insulin syringe here. I'm gonna take the insulin and head on over. So walking over, okay. Come in. Hi, Mr. Jones. My name is Nancy, and I'll be your nurse today. So today I will be administering your medication. I'm going to go ahead and close my patient's privacy curtain. I'm going to go ahead and perform hand hygiene. Alright, Mr. Jones. I'll go ahead and wear my PPE, my goggles. Okay. Alright, Mr. Jones. So before I put on my gloves, I'm going to go ahead and have you, I'm going to go ahead and raise the bed to a working position. I'm gonna also lower the head of the bed just so I can give it in your abdomen, if that's okay with you. Yes, that's perfectly fine with me. All right, Mr. Jones. Okay. Alrighty. All right, Mr. Jones, are you comfortable? Yes, I am. All right, perfect. All right, so now I'm gonna go ahead and perform hand hygiene again. Go ahead and put on my gloves here. And okay, so this is where I will complete my third check of accuracy. Okay, just so you'll have a better angle. Alright, Mr. Jones, I'm gonna go ahead and verify everything. So I have Jaguar J. Jones, and then this syringe here is for Jaguar J. Jones. And then I have MR numbers 4176352. MR numbers 4176352. Alright. You do have an allergy to penicillin noted, and I see on your wristband here you do have an allergy to penicillin. Alright, Mr. Jones, may I also ask, is there any other allergies that I should be aware of? Along with the penicillin? No, just the penicillin. Alright, Mr. Jones. Well, I'm gonna go ahead and see if I have the correct medication here. So I have Novolin R regular insulin, U100 insulin, and I do see that I did bring the Novolin R regular insulin, U100 insulin, and is not expired as well. And I have Novolin R insulin in this syringe here, and I should have 10 units. Yep, I have written 10 units, and there is 10 units in the syringe. Right, and I will be giving this subcutaneously. So I'm gonna go ahead and open his gown, and then I will give this 1.5 to 2 inches away from the umbilical, and then I will also avoid going past your anterior superior iliac spine, and then I'll also avoid going past your costal margins and below your pubis, leaving me with a U shape. Right, and then I will be giving this 30 minutes before your meals. I'm gonna go ahead and check. Yep, you haven't had your insulin shot yet, and you would need this in order to have your meal, just so your blood glucose level is not rocketing. All right, let's see here. All right, and this is where I will do any pre-assessments as well. And I'm gonna go ahead and inspect your skin here. So I don't see any redness, I don't see any bruises as well. All right, Mr. Jones, are you comfortable still? Yes, I am. All right. So I'm gonna go ahead and take an alcohol pad. I'm gonna go ahead and wipe my area. Being careful to not wipe the same area twice. I'm gonna just leave this alcohol pad there just so I know where I'm going to administer it. And since this is a subcutaneous injection, I will grab 2 inches of the skin for a 90-degree injection, or I will grab 1 inch of the skin for a 45-degree angle injection. So go ahead and get that. All right, Mr. Jones, it will be just a slight pinch. So I'll pinch 2 inches of the skin. All right, go ahead and give it a 90-degree angle. Go ahead and check this slowly. All right, I'm gonna go ahead and place it in my sharps container. Oh, okay. Well, if I can. All right, Mr. Jones, I'm applying a little bit of pressure right now. There you go. All right, Mr. Jones, are you doing okay? Is everything good so far? Yes, I'm perfectly fine. All right, I'm gonna go ahead and remove this alcohol prep pad. And remove this. All right, Mr. Jones, I'm gonna go ahead and lower the bed to a comfortable position for you and a safe position. I'm gonna go ahead and put up your side rails back as well, 3 side rails, and I'm gonna go ahead and elevate the head of the bed just so you are able to eat as well, eat comfortably. All right, Mr. Jones, is there anything else I can get for you? No, I think I'm okay. All right, Mr. Jones, well, I'm gonna go ahead and place your call light within reach, and I'm gonna go ahead and come back to check up on you 15 minutes or so just to see how the medication is and allow it to kind of settle in, see if you have any side effects or any allergic reactions. But call light right here. I'm gonna go ahead and open your privacy curtains. I'm gonna go ahead and wash my hands, document my findings, and come back to check up on you. So I hope you have a wonderful meal. Thank you so much. No problem. All right, and this concludes my medication administration. I have completed administering the medication and my third check and all of my checks of accuracy.